Implicit bias in healthcare regarding mental health, race, and gender. Becoming aware of it, noticing the effects of it, what can be done about it.
Implicit versus explicit. What's the difference, and how is implicit bias integrated into healthcare?
Numerous studies have been performed to determine the presence of bias in healthcare. Implicit or unconscious bias being outside of the person's awareness and can be in direct contradiction to a person's espoused beliefs and values, and explicit or conscious, meaning the person is very clear about his or her feelings and attitudes.
It's important to note that medical personnel cannot have control of their unconscious mind better than the general public, but what comes into question is the quality of care received by the unintentional targets of the unconscious bias. Understanding the determinants of health list provided by the Government of Canada, an assessment can be made regarding the relation of implicit bias and the determinants of health.
Patients who suffer from mental health illness are often associated with violence, low economic standing, illegal substance use, or undereducation. These stereotypes that are associated with mental health play a large part in the lack of medical attention received by these individuals. Due to the personal accounts of poor experiences while seeking medical attention, a ripple effect takes place, and less people suffering from mental illness are willing to attempt treatment. Having a history of mental health causes what is possibly an unconscious drop in patient credibility. Having a diagnosis of mental health condition can cause healthcare professionals to implicitly dismiss what the chief complaint of the individual is. The word of the patient becomes less valuable as the person's behavior, history, or presentation are different than what would be considered acceptable or normal. Mental health labels can range from generalized anxiety or depression, to post-traumatic stress disorder, to schizophrenia, and so many more. Each person who seeks care has the potential to present differently based on diagnosis as well as severity of personal symptoms. Issues arise when medical professionals cannot see past the presentation and treat everyone the same or take what the patient is saying with less concern than those who are not suffering from mental illness. The American Psychiatric Association developed a list of examples of the development of unconscious bias within the healthcare system. These include people with mental illness or substance use disorders are being made to feel less than, inequitable investments in mental health services and underfunding of mental health research compared to those of physical health services and research, inadequate training of healthcare professionals, and stigma within the staff and workplace. A person with mental health concerns is not often taken seriously and are disregarded due to the professional's personal impressions. Mental health has not been as thoroughly explored as physical conditions, leaving a lot to be known about how to best treat those suffering from mental illness. Those within the medical field do not receive enough training to confidently and equally treat these individuals. Lastly, hearing someone else's explicit biases can plant a seed of bias without even knowing it has happened. With thorough training and enhanced funding and research, a gap could be narrowed between the care received and care deserved in those living with mental illness. Mental health patients are often assumed to not meet the following determinants, or the determinant is not easily accessible: income and social status, employment and working condition, education and literacy, social support and coping skills, and access to health services. These determinants of health overlap with mental health care in Canada and those living with mental health illnesses. Some are by association and the assumed character of the person suffering from mental illness, while others are resources that would assist these patients but are not always readily available or easy to access. With a better established understanding towards successful treatment of a large span of mental health diagnoses, patients may become more willing to obtain treatment as it becomes more mainstream and understood among healthcare workers. There is an abundance of evidence displaying implicit bias within the healthcare system when treating patients of color. This is an obstacle that today still needs to be overcome. Race or racism is a determinant of health in Canada as well as culture. This means that race or racism have a part in determining someone's health and level of care. History has put many citizens in a position of viewing people of color differently than those who identify as Caucasian. The most recent evidence of implicit racial bias in healthcare are presented throughout the COVID-19 pandemic. In an article by A. Dombrowski, a woman by the name of Carla Monteroso, a woman of color who suffered for months from coronavirus, explains her mistreatment in the ER and the dismissal of her symptoms that she was experiencing. She was extremely hypotensive, febrile, had low oxygen readings, had shooting pain in her legs, and those were just some of her complaints, all of which were said to be equipment malfunctions or were dismissed by the doctor by saying, "I don't think that much is happening here. I think we can send you home." Throughout the rest of the patient's visit, her requests for treatment, such as a CT scan, were denied unless she verbalized to the doctor that she was okay with getting breast cancer from the radiation exposure. Her tone of voice was seen as inappropriate, and a cardiac nurse questions the doctor on his lack of concern for the patient's central cyanosis and tachycardia. The patient further states, because when we go and seek care, if we are advocating for ourselves, we can be treated as insubordinate, and if we're not advocating for ourselves, we are treated as invisible. To be a personal advocate in healthcare is essential, as the patient should be trusted to know when something is happening to their body. Trusting what a patient is saying and providing care based on presentation is a standard that is often not met if the person is of a different race. In 1998, a nonprofit called Project Implicit was established, also leading to the creation of Project Implicit Health in 2011. This organization works to collect data on implicit bias across the world by people voluntarily participating in online tests to gauge a level of unconscious bias. These biases can be physical or mental, with an array of racial tests, Native, Asian, skin tone tests, cultural tests, and more. These tests are called IATs, Implicit Association Tests. The test is designed to provide the participant with a series of images and words. The images represent skin color, and the words represent bad or good. One at a time, a word or image will appear on the screen, and the participant will sort them to the left or right. This provides research into implicit perception of race's association to good and bad. Through the series of tests, the images and words switch sides from left to right and right to left. There are 92 published manuscripts that use Project Implicit data to present data on implicit bias from 2014 to 2023. Although these tests are not directed at healthcare workers, it is important to state that healthcare workers cannot be separated from the general public in how their implicit bias is formed or presented. A healthcare worker and a worker of a drastically different occupation could take an implicit racial bias test through Project Implicit and yield the same result, as both individuals represent a human response and not an occupational response. Healthcare workers are people too and function as such in their unconscious mind. People have been conditioned over time and throughout history to see people of color differently than Caucasian people. This directly translates today to care received by medical professionals to people of color. In the article Tackling Implicit Bias in Healthcare, treatment of patients of color is described as, quote, negative ratings of their clinical interactions, less patient-centeredness, poor provider communication, undertreatment of pain, views of Black patients as less medically adherent than white patients, and other ill effects, end quote. This New England Journal of Medicine article provides in-depth examples of implicit racial bias in healthcare, as well as possible solutions to the issue. In the above quotation, it is implied that people of color are treated as less important, less educated, and the medical concerns are less severe. The person treating the patient may not even realize they are applying care differently than they would if the patient were Caucasian. In terms of a solution to implicit bias in healthcare, the article makes it very clear that studies have been done and proven ways that fail in eliminating unconscious bias from the workplace. Studies to reduce implicit bias show evidence that exposure to counter stereotypical exemplars, recognizing and understanding others' perspectives, and appeals to egalitarian values have not resulted in reduction of implicit bias. AI and other technologies are in the works across many universities and healthcare settings to aid in reduction of implicit bias. Racial biases have become a normal within people in the unconscious mind over time, and although often unintentional, people of color are often treated differently when trying to receive medical care. Until a solution is found, the best course of action is to be aware of our unconscious behaviors and mindful in maintenance of equal treatment. Sexual identity and gender studies have developed significantly in recent years. Gender equality continues to be a barrier in consistent treatment between men and women, and more so now with increased use in pronouns and self-identification. Through development of gender and sexual identity, there remains a drastic difference in how treatment is received based on a person's identified gender, and resources utilized to care for patients differ based on identifications of male or female. The National Collaborating Center for Determinants of Health has a branch of the organization called the Women and Gender Equity Knowledge Network, ran through the World Health Network. This organization aims to address ways in which gender equity can be accomplished in healthcare. There are 7 actions the organization looks to take to improve women's health, one being challenging gender stereotypes and adopting a multi-level strategy to change the norms and practices that directly harm women's health. Stereotypes are something a person may be aware of and consciously act upon, but also a long-standing stereotype can be something a person doesn't notice they are acting on, and it has become their normal. The same can be said for biases being implicit or explicit. Women and men are commonly susceptible to the same medical conditions but can present symptomatically different. Due to this, a male presentation has become a standard in diagnosing patients, and therefore, if a female presents differently, she will often be misdiagnosed or undertreated. Dr. Sharon Allison Odie is a physician who states they're not taken as seriously, whether that's chest pain and they're having an MI, or they've just broken a bone, regarding women seeking treatment. This can be due to perception that a man is less likely to seek medication for pain, so he must be in true pain if he is seeking treatment. Also, women are presumed to have lower pain tolerance than men and will overstate their pain to obtain medication. Women and men are commonly susceptible to the same medical. Dr. Dunkley specifically performs labor and delivery and states there is an implicit bias there between the two sexes when it comes to pain management. Dr. Dunkley elaborates, the perception of pain and perceived severity leads to a lack in medical intervention when treating women in comparison to men. Dr. Dunkley specifically There are more tests available through Project Implicit in which a person can find out if they have implicit gender bias once completing a test. Taking these tests can provide the participant the opportunity to see where they can improve upon their treatment by being made aware of how they may treat a person differently based on their gender. These biases don't only discriminate against patients, but employees in healthcare as well. Certain traits attributed to being a good doctor, paramedic, therapist, or any other medical profession are traditionally believed to be male. Traits such as physically strong, emotionally controlled, assertive, and more are expected to be presented in men over women. To bring the unconscious bias into the conscious mind, such as character trait presentations in the previous slide, an academic health center found that brief intervention involving implicit gender bias self-assessment and educational presentation changed faculty members' awareness of gender bias. This finding led to double the females being hired than those that did not perform the intervention on gender bias studies. This represents not an unwillingness to hire females into the workplace, but rather unknowingly displaying bias in the process of recruitment. To summarize, implicit bias occurs in many more ways than discussed in this presentation. A person suffering from mental health and how they are perceived is often a common and unconscious association to their lifestyle, income, education, or employment, therefore impacting their credibility and, in continuation, the care received. A person of color often receives implicit undertreatment, less acuity, less patient-centered care, causing distrust in medical professionals to appropriately treat them if you identified as Caucasian. A female presenting with similar complaints as a man will frequently be treated differently than the man, leading to a lack of care, distrust in patient's chief complaint or pain, or the patient will be assumed to be exaggerating or manufacturing their symptoms. The first step in solving a problem is acknowledging it exists. In healthcare, there's no denying that implicit bias exists and occurs regularly and to varying groups of people. The question is, how do we become conscious of our unconscious actions? Encouraging people to take the implicit association test within hospitals, paramedic regions, nursing homes will aid in everyone being aware of the biases that they are not currently aware exist within them. Being provided personal results of these tests will ensure that next time the medical professional is treating a person suffering from mental illness or a person of color or a woman in pain, the first thought may be the results they received in testing, and in turn, make them think about the care they wish to provide. Implicit bias in healthcare has already been exposed. The only way to hold oneself accountable to the equitable and equal treatment is by being aware of where our biases are held and consciously taking steps to remove the biases from our interactions and our minds.